I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. Well, the term is called medical gaslighting. And I want to start off with the story of this young lady who was having chest pains. She was just 30 years old. Chest pains. She went to the doctor. She thought it was stress. The doctor told her, well, you're working, you're going to school, and you're a single parent to 2 children. It's anxiety, probably. Gave her anti-anxiety medication. Didn't work. And the problem when you make an appointment with your doctor sometimes is that by the time you see the doctor, you don't have the symptoms, which is what happened to her.
Yes.
And so she was trying her best to describe the symptoms, but she wasn't having them at the moment. So there was really nothing for her to draw on except to try to describe it. So this went on. She had severe and persistent pain. The anxiety medication obviously didn't help. And she knew that the doctors were wrong, but she figured, well, it's the doctor. They didn't find anything. Everything seems okay. So maybe it is just anxiety. Maybe I just need to deal with it. She went back to the doctor again. The doctor finally sent her for MRI, a CT stress test. The cardiologist found nothing wrong at the time. Then April 7th, she woke. This started in January, by the way. So now this is several months that have gone by. So now we're in April in her story. She woke up one day at 3 a.m. with chest pains. She called her dad to see if she can get some painkillers. He didn't have painkillers. She went back to bed. And when she woke up to her alarm a few hours later, she experienced shortness of breath. And it turns out she was having a massive heart attack and was in heart failure. By the time her brother got to her to take her to what he thought might have been COVID, he ended up taking her to the emergency room because she passed out. She doesn't remember anything. And she found out that she was having heart failure. Her heart was not pumping blood as well as it should. And her doctors do not know why this happened. She had no family history of heart disease. And she doesn't have risk factors like smoking or being overweight. She was just 30 years old.
Yikes.
This young lady would have died if she didn't continue to push for answers. Okay? Now let's talk about medical gaslighting. I'm not saying that this was what happened in her case, although I'm questioning how the cardiologist who's trained to
that was a cardiologist she saw.
Yes. Because it was the primary care doctor who told her it's probably anxiety. You can kind of understand that. But then he did follow through and send her for the requisite test. She had the MRI and the CT and a stress test. The cardiologist dropped the ball somehow. I'm not sure how the cardiologist missed this. This is kind of what they're trained to do. And they missed it. So was there some implicit bias there? Maybe that's what happened. Well, she's 30 years old. This, I wonder if she were 50 years old or if she were a man and she came in with the same symptoms with chest pain and tightness in the hand and all this. I wonder if they would have made that mistake. So on to medical gaslighting. Studies show female patients and people of color are more likely to have their symptoms dismissed by medical providers. Research suggests that diagnostic errors occur up to 1 out of every 7 encounters between a doctor and patient. That's a high number. And that most of these mistakes are driven by the physician's lack of knowledge. Women are more likely to be misdiagnosed than men in a variety of situations. Patients who have felt that their symptoms are inappropriately dismissed as minor or primary psychological by doctors are using the term medical gaslighting to describe their experiences and sharing their stories on sites like Instagram. The term derives from a play called Gaslight about a husband's attempt to drive his wife insane. And many patients, particularly women and people of color, describe the search for accurate diagnosis and treatment as maddening. We know that women, and especially women of color, are often diagnosed and treated differently by doctors than men are, even when they have the same health conditions, said Karen Lutfi Spencer, a researcher who studies medical decision making at the University of Colorado, Denver. Studies have shown that compared with men, women face longer waits to be diagnosed with cancer and heart disease, are treated less aggressively for traumatic brain injury, and are less likely to be offered pain medications. People of color often receive poorer quality of care too, and doctors are more likely to describe Black patients as uncooperative or non-compliant, which research suggests can affect treatment quality. Let me tell you, this is what I keep saying. You've got to be your own advocate. This woman would have died if she didn't continue to see her doctor and insist that something was wrong and insist that something was wrong. The subject in this other article, she had a similar condition. She was a runner and she was having shortness of breath. She couldn't run and she knew that her capability was much more than what it was. Her output was just going down. She went to a specialist who was renowned in his field. That doctor dismissed her because she was mid-30s. She insisted, she went to another doctor, had a battery of tests done, and it turned out she had to have open heart surgery. And just to think, this woman would have died if she had accepted the diagnosis from this doctor who was supposed to be the specialist in this field. I can't stress this enough. You've got to find it in yourself to push back when you know something is wrong and when you think your doctor is wrong about the treatment prescribed to you. This is so important. Thoughts?
And I've talked to physicians, and I kind of understand the diagnosis procedure a little bit.
Mm-hmm.
And typically, when a person comes to you with a concern, you try to rule out the most likely or common thing, and say, okay, maybe it's because of stress that you're getting these pains. Maybe it's because of this or that or the other thing. And they start ruling out the obvious, 80% of all the complaints that I get every day are this. However, what is unforgivable is the fact that they tell you you could have a 80% chance that it's A, 10% chance that it's B. They don't tell you what the probabilities are of what could be happening to you. Meaning they say, oh, it's probably stress. And then they leave it at that. They don't say, but there's also a small possibility it could be a clogged artery.
Because then that means that they have to make an allowance for something could be wrong. I better send her for additional testing.
Yeah. And I don't know if it's, again,
what is this instinct with doctors to just not?
Is it managed costs?
Well, that's where I was going.
Yeah.
It's the insurance.
Okay. That was one thing that my doctor said to me.
They say, well, this person, and that's why I resent those cancer questionnaires that you have to fill every time you see an oncologist.
Yeah. Oh, yeah.
Like if I got cancer,
if you got cancer, could you afford to pay for your? Could you afford? And then you have to fill out the scale of yes, I can afford it, no problem. I can afford it, but it might be financially damaging. No way can I afford it, never, no how. Because that's going to determine what kind of treatment you get. If you can afford it, then
they give you that when you go.
Oh, yes. Yes, that's part of your intake now when you see an oncologist.
Mm-hmm.
Wow.
Yes, girl, yes.
Mm-hmm.
But, I really need more women to ask questions, to push back. And you have to keep, I know that I say this a lot. I know I sound like a broken record, and I'm going to keep saying it. And I'm also going to say something a little scandalous. Your doctor is not the expert on your health. You are. You have got to stop ascribing so much power to a person or persons who know nothing about your day-to-day. They don't know how you live. They don't know how you eat. They don't know how you sleep or love day-to-day. They don't know. You know this stuff about yourself. Like that woman knew as a runner that this was not how she normally felt after a run. And that's what prompted her to get help. If she didn't know this about herself and she went to the doctor, she would have been laughed out of the office. She would have died. She would have been running one day and she would have died.
She would have had to lay down and die. She did
Yes.
not lay down and die.
No, that's it. You've got to push back. And I'm not saying that don't listen to your doctor. I'm saying that you've got to have a different attitude toward your doctor. And I know sometimes you don't want to hear bad news, but sometimes you want to be certain, absolutely certain, that what you're feeling is just run of the mill, whatever. You have to make sure to do what's called ruling it out. You know what? I know you say but let's just test for it anyway. What's the worst that can happen? I get a copay bill. Just do it. Just do it. You have to fight. And I know I'm singling women out here because men don't really experience these types of problems. Not really. I mean, not that I've
to the
read.
same extent, that's for sure.
Yeah. I mean, you yourself, Jackie, had the same experience where you were
I
complaining to the
did.
doctor.
I did. I didn't look like the typical patient. I didn't resemble
But
the
you
typical
knew what was normal for you. You knew what was
Right.
normal for you.
I didn't look overweight at the time, but I was overweight for me from what I
Yeah.
was used to, and that
Yeah.
made a difference.
Yeah.
Otherwise, I would have met those criteria and I would have had testing sooner. I would have been
Yeah.
heard sooner. Yeah.
Yeah.
Also, a lot of times poor people don't feel empowered with the doctor.
That's the problem.
That they can ask.
Yeah.
Like the doctors just, they put you in a room, they talk to you for 2 minutes, and then they're on to the next.
And
one.
sometimes these doctors can be very dismissive too. Like, I'm the educated one here, and I'm the one with the degrees, and I said, and this is what it is. And sometimes there's no room for, and I would argue that if you have a doctor like that, it's probably time to change doctors. And maybe in your area and maybe with your finances, it's not that simple, but maybe there's something to be said for going out of your way to find a better doctor, or maybe switching to a telehealth option, or maybe, I don't know, but you've got to keep trying. You've got to learn to trust yourself and that innate wisdom you have. I'm not suggesting treating yourself. I'm suggesting empowering yourself to have a different conversation with your doctor. Right. You've got to stand toe to toe with them. I don't care how many degrees they have. I don't care if you have a degree or not. I don't care if you have a high school education. Right. I don't care if you have a junior high school education. You're the patient. It's your body. Right. These are your symptoms. This is your life. You have to live with the consequences, not them. Please, I'm begging you, empower yourself. Right. Talk to these doctors.
And I'll give a real quick scenario. Let's say you have heartburn, you go see the doctor asks you, do you eat spicy food? You say yes. Doctor say, oh, it's probably heartburn. At that point, some people just pack up and go away and try to see if it's heartburn. And then maybe 2 months later they stop. But the protocol here is to tell your doctor, okay, if I stop eating this spicy food, after how long should this?
That's the other thing.
Good question.
Those are probing questions.
Yeah.
So ask that. Then say, if after 2 weeks this heartburn is not gone.
Yeah. Give me some milestones. Exactly.
Can I make an appointment to see you? Because let's all be real here. 80 to 90% of the time, it is the common thing. But these stories we hear about is when it wasn't the common thing.
But these stories are becoming more and more common.
Well, the fact that people,
especially with young people,
I think social media is an age.
Yes.
And people are getting
a lot of this stuff was much more isolated.
Where before it was, three arm lengths away, you didn't hear it. Now it could happen to anybody. We hear about it.
Yeah.
But the important thing is that you have to go and play this out with your doctor. If my chest pain doesn't go away after 2 weeks of me taking it easy, going to sleep and not worrying, what should I do? If I get another chest pain in the middle of the night after hearing this, what should I do?
Yeah.
At what point should I come back to you? What can I do immediately if I feel I'm in danger? All of those things have to be talked out with your doctor. This is your time. This is your FaceTime with the doctor. Yes. Don't let them go easily.
No.
Have them earn their money.
That's right.
Okay. And that's my
That's right. That's right. They're getting paid to see you. Don't think that because you have Medicaid or Medicare or something that this is free somehow. It's not free. They're getting paid. They're not seeing you out of the kindness of their heart. Please, I'm begging you, advocate for yourself. Know yourself. Talk to your doctor. All right, that's the time we have. Remember, you only have one life and one body. So you got to do your best to make it count, girl or guy. So your years are full of life and full of health. Information equals transformation. So Take these small steps each day and you'll see a difference. I am sure of it. Guys, it's been fun as usual. I'm sorry that we were talking earlier and it was like such a bummer and I had like that little explosive thing about what happened at the Oscars, but that
I thought
really
it was necessary. I thought it was necessary, and you voiced your opinion.
it still sits very terribly with me, and I hope this feeling goes away at some point, but maybe on some level I hope it doesn't go away, because this shouldn't just go away. This should bother people as much as it bothers me.
Fair
Anyway,
enough.
all right, so that's all the time we have. I'll see you guys next week.
All right. See you guys next week. Bye.
Bye.
Okay.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.